DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show today. We will have Dr. J.D. Folsom here from Rexburg, Idaho with cattle health and reproduction services, and we're going to talk about pregnancy testing, about interpretation of those pregnancy tests, and much more. He's a great wealth of information, so stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodiris, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk, and I just want to say welcome to Dr. J.D. Folsom. Thanks for being on the show.
It's good to be here.
It's great. Dr. Folsom has his practice in Rexburg, Idaho, and it is cattle health and reproduction. And we've been acquainted for many years. And Dr. Folsom is one of those leaders in our veterinary profession and in the beef industry. And for me to be able to catch him and get him on the show, it's a great honor. So thanks for being here.
Well, yeah, it's a pleasure for me to be here as well. So,
and beautiful part of the country that you live in.
Yep. So we're just on the west side of the Tetons. And so, yeah, it's really pretty right there in the Snake River Valley, Snake River Basin. So
that's
awesome.
It's
a good place to be.
Yeah, awesome. So tell us a little bit about your practice.
We're like probably 95%, just beef cattle. We do the occasional horse for one of our producers. But aside from that, we do take care of some, like a big dairy heifer development yard. Mm-hmm. But aside from that, it's all just, beef cattle. And most of it's cow-calf. We have some feedlots, a lot of guys in the background, their calves, and then a lot of guys that'll feed their calves before they go back to grass that following summer. But that's, that's the kind of the extent of our practice. We do lots of ultrasounding for pregnancy, diagnosis, fertility testing bulls. That's a big part. We do a fair bit of embryo work for clients, do some breeding. And so, but that's, that's the mainstay of what we do.
It's awesome. And this, we're going to talk about reproduction and preg checking and ultrasounding and different things like that for cow-calf producers. But, the one question I get is hey, why do I preg check? And it seems for you and I, it seems like, well, why would you ask me that?
Right.
But, we have people out there that aren't. And so what are some of the benefits, or what do you see as the biggest benefits?
Well, we live in an area where, we have considerable snow in the wintertime. And so, from by usually Thanksgiving, we're feeding hay or some sort of ration to these cows. And so if we can preg check, if they're not carrying a calf, send them to town. There's no sense. You probably spend $200 at least, $300 in feed. Some guys feed cattle till mid-June before they go back to grass.
Wow.
And so you got a considerable cost into these animals. And also with preg checking, you can, if we can get access to the cattle early enough in the fall, a lot of people in our area will run cattle up on Forest Service, and sometimes you just don't have access to them. But if we can get to them, we can stage those cattle into cycles, or the month that they're going to calve. And so, maybe they need to thin down their herd. It's just a management tool so they can get, those late calvers,
yep,
narrow down the time that they have to spend calving cows. And so, I just think it's a no-brainer. As far as...
So get two things there that you mentioned, and we'll wrap up and go to commercial. But one is making sure they're pregnant if you're going to carry them for the winter. The other one is the importance of staging them
Yes.
So you know what you're carrying and how long that calving season is going to be, and managing your resources.
Yep, exactly.
So phenomenal. It's a great start. We're off to a great start with Dr. J.D. Folsom. We're going to take a break. Thanks for watching Doc Talk, and we'll be right back. Hey folks, Dr. Dan here. Welcome to your Cattle Intel by Neogen. Today we're going to talk about something we have talked about for a long time: injection sites of cattle. The injection site for cattle is this injection site triangle that is located between the vertebral column, the point of the shoulder, and the nuchal ligament. Anywhere between the skin and the skin on both sides in that triangle is nothing but muscle tissue. We want to make sure that we provide those injections in that triangle. The other thing is, don't inject more than 10 to 15 cc's per site at any time, and depending on label of the product. And the second one is making sure that when you do space injections, space them about a hand width wide between, so that they have proper area to develop and distribute the product that you're injecting. Make sure that you use the proper needles. Make sure that you use sub-Q or IM, depending on what the label of the product is. Always work with your local veterinarian. And this has been your Cattle Intel Minute by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most: real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to Doc Talk. I'm Dr. Dan Thompson here with Dr. J.D. Folsom, and he's from Rexburg, Idaho. Cattle Health and Reproduction, and is the name of his practice. And as we left, we were talking about the reasons to preg check. And so now kind of walk me through, when do you like to have your clients do the pregnancy test, and you know, what techniques are you using?
So almost exclusively ultrasound at this point. And I know there's some guys that'll use like an introducer, but I will actually I'll arm them just like as if I was preg checking them normally with the ultrasound probe in my hand. I feel like I can do a better job that way. Like with the heifers, like we'll start ultrasounding heifers mid-July. I mean, and a lot of that is you can see the whole calf. It's just easier to stage that and break those stages into cycles for those producers. And some guys will want to even get the gender of the fetus.
Yep.
And so it just makes it to where you can do that. So by mid-July, we're going pretty heavy with the heifers. And then again, if we have access to those cows, a lot of guys in our area have bulls in for 45 to 60 days.
Yep.
And we have guys that'll start, it just depends on when they start calving. We have guys that are big farmers and they'll start calving end of January because they want to be off field so they can start working them. And then we have guys that don't farm and they don't start calving until March. And so a lot of that just kind of depends on when that aligns, if they can pull bulls. And then with ultrasounding, we got to wait at least 30 days after pulling those bulls so I can see a heartbeat.
Gotcha.
On those calves.
So So anytime after 30 days with the ultrasound, and then is there a time limit on the top end? Or?
Well, no, but I feel like you lose. In my experience, they get past 110 days, 4 months. You're losing, like, that calf kind of drops deep down into the belly.
Yep.
And they're just more subject for error. And so, I mean, 110 days and less, I feel like we can be very accurate as far as staging when that calf is gonna calve. The further in gestation they get, there's more room for error.
So as we see, you're gonna see technology that comes along to, the do-it-yourself pregnancy tests and different things to that nature.
Right.
You can't stage them and sex them and do the kind of information that you're talking about.
And with that too, is they run them through the chute to pull blood or whatever it is, milk, and they don't get results for a couple days. So I know on the beef side, I know it's different on the dairy side when they have access, but on the beef side, they got to bring those cattle back in,
right, and
run them through the chute one more time or sort them, whatever it is. With us, like, we know right there if they're open, they can sort them off.
In real time.
Yeah.
So it's a tremendous service. The advent of the ultrasound has changed the game.
Mm-hmm.
And I mean, I'm a feedlot vet, so bear with me, but the accuracy on sexing, extremely accurate.
Well, I think it's more accurate sexing than it is staging. Like, I feel there's variability, like, depending on breed, calving ease, whatever that is, goals that the producer has. Like, there's going to be some variation in size, but I mean, like, if between 90 days or 60 and 90 days, I mean, it's all but 100%.
That's awesome.
With doing the gender. So
that's awesome, folks. Incredible technology. It's great to get Dr. Folsom here on the show. We're going to take a break. When we come back, we're going to talk about interpreting those results here on DocTalk.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cow side and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/DocTalk.
We are a start-to-finish yard. Bring them in at 500 pounds and finish them out to 14 to 1,500 pounds. Max capacity is about 15,000. We begin with the end in mind, which that means it starts from day one coming off the truck. Heard all sorts of stuff about the generics coming out from, a few different companies here and there, but we started working with Bimeda. What I like about working with Bimeda is our rep. He seems like he's just one of us. He knows, he's been in the cattle feeding industry for a long time. He understands where we're coming from, what goes on in the feed yard. So we started implementing Macrocin last July, and we're using it as our first poll treatment. The data shows that success rates on BRD, they're equivalent to the other macrolides that we were using. We just feel fortunate enough, I guess, to get our hands on it, and it works great for us for a first poll treatment. It's what really jumped out to us working with Bimeda, meeting with the rep. Macrocin's affordable. We finally got a product that everybody can afford. We try to do the little things right, whether it's from low stress cattle handling, animal welfare, how we work with the cattle every single day that's something we really focus on. But when you've got a product like a Macrocin, it's just another assurance protecting you, controlling your BRD from what stressors are thrown out there or what Mother Nature is going to bring to you. This industry, it takes everybody, whether it's working with the nutritionist, it's cowboys working with the veterinarians. Everybody plays a part, and we expect them to do their jobs, but also we expect, the drugs or what we put into the cattle to do their job too. And I think these Bimeda products, they're proving that they're doing the job for us.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. J.D. Folsom. And Dr. Folsom is the owner of the practice Cattle Health and Reproduction. He is located in Rexburg, Idaho, and just one of those people that is salt of the earth, that is propelling the veterinary profession, and to go out there and serve. We talked about rural practitioners and the need. We're just very thankful for what you do.
Yeah. Well, I enjoy it, so.
I know that. So let's talk about, okay, so when you preg somebody's herd, tell me what you're interpreting if you're looking at their herd after you get done.
So first off, so shoot side, like I always have a tech with me with like a handheld deal, and we're writing down, visual IDs or scanning EIDs, whatever it is, into this deal, and then it'll automatically, so I'll call days, like how many days pregnant they are, and then the program will kick out their due date.
Okay.
And then that way we have something nice, like an Excel deal that we can kick back to our client. But going into breeding season, if cows are in the body condition they should be, mineral status is good, just healthy in general, typically we're seeing in that 65% in that first cycle.
Okay.
Then you'll get another 30%, 20 to 30% in that second cycle, and then you'll get some stragglers in that third cycle. And so if something's wrong, if we're way off of that 60% or whatever it is, it's telling us something. Whether cows were too thin going into breeding, it lets us know if there's something we need to look into.
You bet. And that's what I always found, data. Everybody wants data, and data just gets you to the place that you need to be looking.
Right.
Whether it's a feed yard or a cow herd, if I need to be in the processing barn or in the hospital or with the pen riders or whatever, we don't really know what the root cause is until we start stepping on the farm, which is another thing that when you're working with a veterinarian, a professional that's doing the pregnancy determination, now you have a set of eyes that it goes beyond the yes, no, or even the staging. Now it's like, okay, if there's an issue, let's fix it.
Right. And even judging progress you're making. It's right. Say there is something wrong, or you decide to start working with your veterinarian. You can gauge the progress you're making based on keeping accurate records. Like if you don't, it's just hard to remember what your open percentage was the year before, or it's just tough to keep up on all of that.
Yeah. What should a producer be looking for? Would you say would be typical pregnant versus open?
It varies. Depending on at least in our area range. Yep. If they're out on the desert, those cows have to work a lot harder. But I feel like in a 45 to 60 day window, you should be at least 90% pregnant. And again, that can vary, but that's kind of, there's guys that are way better than that, and guys that fall a little bit short of that. But that I kind of feel like you kind of need to be at least that 90%.
It's outstanding. It's great information, folks. We're going to take a break. When we come back, we're going to wrap up with Dr. J.D. Folsom right here on DocTalk.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. J.D. Folsom. Dr. Folsom is a veterinarian. He's in Rexburg, Idaho, which is a beautiful part of the country, and he owns and operates the veterinary practice there, Cattle Health and Reproduction. Pretty much an exclusive cow-calf, cattle feeder type veterinary practice. And so when you start to line up and you think about, okay, what are some key areas that if I'm going to talk to my producers to prep cows or to have positive outcomes on reproduction, what are some of those things that you're visiting with them?
A big thing we hit on are like vaccine protocols, timing of the vaccine, body condition. I feel like that's probably one of the biggest things that we talk about, and that's like turnout when they're breeding, and even it's a good gauge when we're preg checking. Usually it's around weaning time. I feel like you can get a pretty good feel for range conditions, mineral status of those cattle. Like at preg check, you get hair coats are rough. I mean, I just feel like we can kind of judge, I guess, guide the conversation of what things need to be discussed kind of based on the condition of the cow. I think that's probably the most important thing to discuss.
Well, so I think you hit on the big ones: body condition score, coat, just the appearance of the animals. I mean, you can tell. Mm-hmm. And then the vaccine, relative to breeding. What would be your optimum range? Number one, we always clarify, work with your local practitioner.
Right.
But how many days prior to breeding are you looking to vaccinate?
So again, in our area, I mean, kind of the gold standards is to vaccinate. I mean, I was right. Like, if they can get vaccine 60 days before breeding, but I mean, at least 30 days. I mean, nothing within that 30-day window before bulls are going out. We do have a lot of producers where we will develop their heifers on kind of a modified live program. And then as soon as they're confirmed pregnant, they'll go into kind of a killed vaccine program and they get their shots at preg check in the fall. And a lot of that is just, I mean, those cattle get worked once a year.
Right.
And it's important. I mean, if they are getting worked once a year, again, for me to recommend a safe vaccine, I'm going to recommend a killed vaccine at preg check. But if you're given shots prior to breeding, I mean, again, like I recommend to get those shots at least 45 days in. The earlier you can, the better, but no sooner than 30 days.
We have a lot of veterinarians that just exactly what you said. My pre-breeding vaccines in those non-pregnant females are modified live, but once they're confirmed pregnant, no more modified live.
Yeah.
So,
Yep.
great information. Thanks for being with us today.
Yep.
Really appreciate all that you do. Folks, thanks for watching DocTalk. Remember, always work with your local veterinarian. And if you want to know what we do at DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson here with Dr. J.D. Folsom, and we'll see you down the road.
Merck Animal Health is the global animal health business of Merck. Through its commitment to the science of healthier animals, Merck Animal Health offers veterinarians, farmers, pet owners, and governments one of the widest ranges of veterinary pharmaceuticals, vaccines, and health management solutions and services, as well as an extensive suite of connected technology that includes identification, traceability, and monitoring products. Merck Animal Health is dedicated to preserving and improving the health, well-being, and performance of animals and the people who care for them. Merck Animal Health is present in more than 50 countries, while its products are available in some 150 markets.